We often hear about heart attacks or strokes feeling like they come out of nowhere.
Right, like a sudden event.
But usually there's a whole backstory happening inside our arteries, isn't there?
Absolutely. It's often a long process, and smoking plays a huge, really damaging role in that story.
Yeah. So if you're listening and you, or someone you care about, are managing conditions like peripheral arterial disease, PAD, or cerebrovascular disease, or coronary artery disease,
Then this deep dive is really aimed at you.
exactly. We've looked at information from vascular surgery, biology research, clinical guidelines,
Mm-hmm.
all that sort of stuff.
Trying to get to the core of it.
And our mission today is, well, pretty straightforward. To explain why quitting smoking is so critical, not just helpful, but really non-negotiable for managing these specific vascular conditions and, frankly, improving your future.
And I think the starting point really is understanding the common enemy here,
Okay.
which is atherosclerosis. Even though PAD, stroke risk, and CAD affect different areas.
Legs, brain, heart.
Right, they often share that root cause.
Okay.
Atherosclerosis. It's that slow buildup of plaque, that hardening and narrowing of the arteries.
Okay, so plaque buildup is the main problem.
Yeah.
How does smoking fit in? Does it just speed it up?
It's like pouring gasoline on a fire. Smoking is a massive catalyst for atherosclerosis.
Yeah.
Every single cigarette triggers a whole cascade of harmful effects.
A cascade. So multiple things happening at once.
Yeah. Think about the chemicals in smoke, hundreds of them. They directly injure the inner lining of your arteries, the endothelium. It's a delicate layer.
Injure it how? Like scratching it?
Sort of. That injury causes inflammation. It makes the artery walls stickier, almost like Velcro.
Okay.
So cholesterol, fats, other substances floating in the blood, they grab on much more easily, forming that plaque.
Ah, so the damage makes it easier for the plaque to start and grow?
Precisely. And crucially, this isn't just happening in one place. It's systemic. It affects blood vessels all over your body.
That makes sense. Why it connects PAD, stroke, and heart disease then. Okay, let's zoom in on PAD, peripheral arterial disease. That's the limbs, right? Legs mostly.
Usually the legs, yes. And with PAD, smoking does more than just speed up plaque buildup. There's nicotine.
Right, the addictive part.
Yeah, and nicotine is a potent vasoconstrictor.
Meaning it tightens the blood vessels.
Exactly. It makes them physically narrow. So you already have reduced blood flow because of the plaque, and then the nicotine squeezes those narrowed vessels even tighter.
Wow. So it's a double whammy. I imagine that really affects people, like when they walk.
Definitely. It directly leads to more pain, especially during activity. That's what we call claudication. It's a cramping pain that forces you to stop.
And less blood flow must cause other issues too, like healing.
Oh, absolutely. Reduced blood flow severely hampers healing. So for smokers with PA, even a small cut or a blister, especially on the feet, can turn into a serious non-healing ulcer. The risk of infection skyrocket.
That sounds incredibly serious.
It is. And in the worst cases, poor healing and infection can lead to amputation. It's a devastating outcome.
But there's hope if you quit.
A lot of hope. Quitting smoking can significantly slow down PAD's progression. Often people find they can walk further with less pain relatively quickly after stopping. It makes a real difference.
That's powerful. Okay, let's shift focus upward to the brain. Cerebrovascular disease and stroke risk. How does smoking play into that?
Again, it comes back to atherosclerosis, particularly in the carotid arteries.
Those are the big ones in the neck supplying the brain.
That's right. Smoking accelerates plaque buildup there, causing carotid artery stenosis and narrowing. That alone can reduce blood flow.
Okay, so narrowing is one problem.
But there's another major risk. Those plaques in the carotids can become unstable. They can rupture, or a piece can break off.
Like debris.
Exactly. That debris travels up into the smaller arteries within the brain, gets lodged, and blocks blood flow.
Causing an ischemic stroke.
Precisely. Cutting off oxygen to part of the brain. Smoking also damages the tiny blood vessels inside the brain itself, increasing risk further.
So it attacks both the highways and the small local roads, so to speak.
That's a good way to put it. But the key message here, again, is empowerment. Quitting smoking is probably the single most effective thing you can do to lower your risk of having a first stroke or another one if you've already had one.
And the benefits start quickly.
Almost immediately. Inflammation starts to decrease, the progression of plaque slows down. It really matters.
Okay, legs, brain, now the heart. Coronary artery disease, CAD. We all know smoking's bad for the heart, but what are the specifics? How does it damage those crucial coronary arteries?
It's a similar pattern, unfortunately. Direct damage to that inner lining, the endothelium of the coronary arteries. This kicks off the atherosclerosis process right there in the heart's own supply lines.
Leading to chest pain, angina.
Yes. Angina is often the first warning sign that squeezing pain when the heart muscle isn't getting enough oxygen. But smoking adds more layers. Vascular biology shows it's strongly pro-inflammatory.
Meaning it fuels that inflammation in the artery walls we talked about.
Exactly. Makes the plaques more vulnerable, more likely to cause problems. And it's also procoagulant.
Procoagulant, meaning it makes blood clot more easily.
You got it. It makes the blood stickier, more prone to forming clots.
So you've got narrowed arteries, inflamed walls, and blood that wants to clot.
Yeah.
That sounds like a recipe for disaster.
It really is. That combination drastically increases the risk of a clot forming suddenly, blocking an artery completely and causing a heart attack. It also raises the risk for arrhythmias and heart failure down the line.
But quitting helps here too, presumably.
Massively. And rapidly. Quitting smoking is one of the most powerful interventions for anyone with CAD or even just at high risk. Blood gets less sticky quite fast, inflammation reduces, the benefits kick in almost right away.
Okay, the message is crystal clear. Quitting is absolutely vital across all these conditions. But we also know it's really, really hard for people.
Incredibly hard. Nicotine is highly addictive.
So for someone listening who knows all this but is struggling, what actually works? What does the evidence say about cessation techniques?
That's the crucial practical question, isn't it? And the evidence points strongly towards using a combination of strategies, not usually just one thing in isolation.
Okay, like what?
Well, first off, counseling and behavioral support. This is fundamental. Talking to healthcare providers, joining support groups, using quit lines.
Does that really make a measurable difference?
Oh, absolutely. Studies consistently show that getting that kind of behavioral support significantly increases your chances of quitting successfully long term. It helps with coping strategies, motivation.
So don't underestimate the power of talking about it and getting guidance.
Definitely not. Then there's nicotine replacement therapy, NRT.
Patches, gum, lozenges.
Exactly. Patches, gum, lozenges, inhalers, nasal sprays. These give you controlled doses of nicotine without all the other toxic stuff in cigarettes.
How does that help?
It helps manage the physical withdrawal symptoms, the cravings, the irritability, the difficulty concentrating. Those can be overwhelming and often lead people back to smoking. NRT takes the edge off, letting you focus on breaking the habits, the psychological side.
So it eases the physical part while you work on the behavioral changes. Makes sense.
And then there are prescription medications.
Like pills.
Yes, prescription drugs like varenicline or bupropion. They work differently in the brain to reduce nicotine cravings and make smoking less satisfying if you do slip up.
So several options on the table.
Right. And what's really key for you, the listener, to understand is that combining these often works best.
Like counseling plus NRT or
It-
counseling plus medication.
Exactly. The combination approach usually yields the highest success rates, but it's very personal. What works best depends on the individual.
So talking to your doctor is key to figure out the right plan for you.
Absolutely essential. Discuss your smoking history, your previous quit attempts, your concerns. They can help you navigate the options and create a personalized strategy.
Okay, so wrapping this up for you listening. If you have PAD, cerebrovascular disease, or CAD, the takeaway is unavoidable, isn't it?
It really is. Quitting smoking isn't just a good idea, it's a critical medical intervention.
With real measurable benefits. It slows down the disease, slashes your risk of terrible events like stroke, heart attack, amputation.
And improves your day-to-day life, reducing pain, improving breathing.
And crucially, it's never too late to stop. The body starts to heal remarkably quickly.
It does. Your vascular health starts improving almost from the last cigarette.
So the most important step you can take right now is to talk to your doctor or healthcare team. Explore these cessation options. Get support, make a plan.
Remember that smoking fuels that underlying atherosclerosis everywhere. Quitting starves that fire. You're tackling the root cause across your whole system.
So maybe just take a moment to think about that. Picture what quitting could actually mean for your life. More energy, less worry, being able to do more. What positive changes could you see? Hold on to that thought. It's a powerful motivator for taking this step for your health.